Hey everybody, it's Andy, and I've got your pre-quiz, which is actually a post-quiz, because if you get all these answers right, you probably don't need to have me teach anything about back pain. Since I live in Vermont, I thought I'd let you all know more about where I live. And this is the Vermont Backache quiz. Olympic Nordic ski coach Sverre Kaldman has back pain. It started as a pain in the neck after he was suspended for bad behavior last year. Sverre wouldn't do that. Would you order an X? When would you order an X-ray? A, when he insists that you radiate his innards or he'll wax your skis with tar. B, only if he has a significant other medical problem or severe trauma. C, when you own the X-ray machine. D, if you want to get him out of the office faster. Okay. Number 2. Middlebury College is a famous school here in Vermont. And William S., a very senior member of the English department, suffered an episode of severe back pain. It's gone on for a 12th night. His surgeon, Dr. Yorick, alas, poor Yorick, I knew him well, recommended an operation. He should out with you, Spot. Get a second opinion from a non-surgeon specialist. First kill all the lawyers or doctors. Get thee to a nunnery. Answer to number 2. All right. Number 3. Vermont's Governor Phil Scott is very famous for having the most successful pandemic control in the United States, but his budget has become a real pain in the butt. His doctor determined that the pain in the butt was not dangerous, so he should A, go to bed until he's better, B, go about his usual insanely busy schedule despite the pain, C, try to do everything he can to push through the pain, or D, stand upside down in a kayak like my daughter Molly does. That's a real skill, I tell you. Couple seconds for your answers. Gets worse, gets harder. This is a great big ship at the Shelburne Museum, which is a whole community of museum. It's huge. A snowbird is somebody who lives in the South and comes north in the summer. So a snowbird flies up to Vermont in mid-February, which is cold, because he's very concerned about his lumbar spine X-ray report. It says he has degenerative arthritis, degenerative joint disease, and collapsed disc. This means A, he needs an operation to avoid becoming quadriplegic. B, he's over the age of 40 and he is Homo sapiens. C, he spent too much time standing in line at the Shelburne Museum. D, his back pain is severe enough to require house call to Florida in the winter when it's warmer. Take a second, write down your answers. That is Mount Mansfield. Even in Vermont, people sue each other for dumb reasons. That's the American way. Malpractice attorney HBS Corpus III has tried to talk himself out of his pain, but he's paid by the hour and he ran up a horrendous bill, so he had to stop. Finally, he decided to try manipulation. He should A, undergo an autopsy first to be sure it's safe. B, make sure the practitioner teaches him self-manipulation or specific exercises too. C, set a deadline of 1 month, quit or get a second opinion if he doesn't see progress. D is B and C. Come up with some answers. Or ride your mountain bike down a mountain, which is a crazy thing to do. All right. Ice hockey. You don't play that much in Africa. Vermont epidemiologist Ben Counton, PhD, decided to work with a physical therapist. It's a great idea, but Dr. K wonders about the quality of the therapist. What aspect of the lean, virtual, outcome-based, patient-focused quality improvement continuous circle of quality jargon should he endorse? A, therapist should watch him ride an exercise bicycle for many dollars an hour. B, Therapists should watch their assistant who is watching him get a hot pack or an ultrasound or an electrical stimulation for many dollars an hour. C, therapists should perform hands-on treatment or teaching for most of every visit. D, therapists should offer him the 6-month treatment program at a discount. Take a minute to figure that one out. And up in the right-hand corner in Vermont, there's the box where they sell ice in the middle of the winter. Now, I don't know about this state. Gets really cold here. All right, next. Do you know who the guy is up in the corner? That's our very famous Senator Bernie Sanders and former presidential candidate. He was sitting like that with those mittens on at President Biden's inaugural because he was told that his MRI showed spinal stenosis. You should A, congratulate him on his longevity. B, ensure that the doctor was treating his symptoms, not the photograph. C, consider EMG testing before undergoing major surgery for the stenosis. D, all of the above. I bet you're looking at that MRI to try to figure it out, huh? That's kind of silly. Got your answers? Next one. There's a map of one of the ski hills, and there's a cow. The guy that I ski with at Stratton Mountain hurts every day, so he can't go bombing down the bunny hills with me. The bunny hills are the ones that I take my African friends on and they still fall. They are not the Black Diamond Cliffs that my son goes down. You advise A, take Doan's pills. I hope you don't have Doan's pills. They're actually aspirin at a higher price in combination with OxyContin. B, pay somebody else to ski for him. C, look for a spine rehab team with a physiatrist, physical therapist, occupational therapist, and pain psychologist. D, ride the lifts up and down for a whole afternoon. He'll freeze his butt to the point where it just doesn't matter anymore. Throw in your answers. When I ride my bike, I always say hello to the cows. They usually look up and don't really say hello back. We're very famous for our milk and cheese and ice cream here. All right, here we go. Middlebury High School sends their kids to Ghana every year, believe it or not. And when they visited Africa, one of the students really overdid it with the African drums. Now his back muscles feel as hard as rocks. Drugs that effectively treat muscle spasm include A, muscle spasm drugs, B, anti-inflammatory drugs, C, narcotic analgesics, D, stretching, ice, and more stretching. Yeah, and us Americans, we don't know how to do the drum things. No, at least not me. It's pretty cool to watch. And over on the left-hand side is one of the many, many church spires in the middle of our fall, autumn season when all the trees turn orange and red and yellow, and they're just beautiful. A lot of people come from all over the world to Vermont for a leaf peeper season. That's the other thing we make here is maple syrup. The Maître D at Al's Fries, a very expensive restaurant known as a greasy spoon, you can imagine. Al's Fries. Visits the clinic, complaining that by the end of the day, his back is killing him. You advise A, he should lift with his legs and not with his back. B, he should hire somebody else to do the lifting. C, he should lift naturally if he does have to lift. D, to decrease the strain, he should degrease the tablecloths before lifting them. And E, whoop, that's an E, not a D, both B and C. So A, B, C, D, or E. Well, if this survey raises more questions than answers, then you probably are pretty smart. The Vermont Teddy Bear Company makes teddy bears, and we have real bears. My dogs ran into one a couple weeks ago, and it was really, really big, and we went the other way. After predicting last week that COVID might actually return, Dartmouth University, right on the border of Vermont, economist Bear Marquette also recommended that an economic stimulus was needed. Specifically, he advocated bailing out the profit takers. So you offer to help by prescribing the newest brand name drug. You point out that at best, chronic pain medicines get rid of about 30% of pain, plus they A, sometimes taste icky, B, often cause drowsiness, balance problems, and other complications, C, are sometimes still worth it as long as you can balance the risks and the benefits, D, all of the above. Bears knock over your garbage can. Number 12, do you know Ben & Jerry's? I think you get Ben & Jerry's ice cream in your countries. It's from Vermont. Ben and Jerry are real Vermonters. There they are. And they are very liberal-minded people. So while protesting our nuclear power reactor, which is already closed down, ice cream legends Ben and Jerry both began to get low back pain that radiated down their legs. Ben wondered about an injection. Jerry just ordered vanilla. We tell them that spinal epidural injections for radiating leg pain are best done A, in the morning so the doctor can go golfing, B, 3 in a row so the doctor can afford to go golfing, C, using an X-ray fluoroscopy machine, D, by a certified public accountant. Think that one out. I hope you're done thinking. I want to ask questions. You can't, sorry. Here we go. Final grade, you can't fail this. It's a pretest. But here's what we need to learn over time. If it's acute pain, your job is to reassure the patient and get out of the way. Subacute pain is when you act like an internist, aggressive diagnostics and treatment, and then stop. Chronic pain is a rehab thing. It's not a physiatrist alone either. It's a rehab team thing. If somebody ever thinks they need surgery, they need to talk to a non-surgeon first. And we will talk about all these things when I start teaching this month. I'm looking forward to it all. Let's see if I can turn off the meeting. There we go. Bye, everybody.